Questions that came up is, what about gas? And it's an important issue because it can be a problem. And in fact, if you don't understand some of the ways of owning and managing an MGB, you can really suffer quite a bit. You can have bloating, abdominal distension, crampy pains, trouble with gas, diarrhea, intermittently, nausea and vomiting, and all kinds of problems. So understanding this issue is very important for managing and enjoying your mini-gastric bypass afterwards. Remember that the foundational principle of the gut is it's designed to digest and absorb fat. In other words, that's its purpose in life. You know, your eyes have a purpose of seeing, your bones keep you up, right, and let you walk around. And the gut is supposed to take in food during its long course, 33 feet of gut, and take food like fried chicken and turn it into skin and bone and brain. Well, that's a major request, and it does it so well that sometimes you get excess weight. So the digestion process is that's okay. The digestion process is normal, it's powerful, and in some people it's a little overdone. Okay, so then people come to me and they say, my digestion process is working too well. I mean, I'm really doing a good job of packing on the pounds, of taking fried chicken and pizza and all kinds of foods and storing it. Okay, and so we say, no problem, we have the solution. 20 to 40 minute surgery, home the next day, and we're going to interfere with digestion. Okay, we're going to impact it. And the impact that's necessary is tremendously powerful. It must be powerful therapy because all of you and thousands of my other patients have invested so much in trying to fight this battle and failing. So it says that the problem itself is major, so it requires major or powerful therapy. And in fact, the MGB is tremendously powerful. In addition, the MGB has risks and associated problems, and so somewhat like buying maybe an Italian sports car, it's more difficult to manage. It requires more attention than, say, buying a Ford F-150 pickup truck, which you could just, beat the heck out of and not change the oil and not get it tuned up and things like that. So we're going to give you this new, extremely powerful tool, which we expect is going to be powerful therapy and effective therapy. It's going to cause massive weight loss. So in each of you this morning, we're looking at 100 to 200 pound weight loss. A tremendously powerful impact on your life. And we heard yesterday in clinic of the transformational effects of this. But we can't underestimate the power of the surgery. Now what we're going to do, again, just to summarize, is we're going to do 2 anatomical things, and then we're going to see some hormonal changes. And then we're going to come back and talk a little bit about how those things impact digestion and the development of gas, and then how to manage that. Okay, what are we going to do? First, we're going to make the stomach smaller by the stapling. And as we do that, we cut through the vagus nerve, which decreases ghrelin, G-H-R-E-L-I-N, ghrelin, the hunger hormone. So we heard yesterday, and you've talked to patients of mine, they're less hungry after surgery. Okay, that's good. Not zero hunger. So we expect that after the healing process, you're going to be able to go to dinner. You're going to be able to enjoy steak and lobster, excuse me, wonderful salads and ice cream and cake and things like that. But all in moderation, and all kind of designed to be based on a foundation of a healthy diet. But you're not going to be suffering from vomiting. You're not going to be faced with going out to dinner with friends or a business meeting or something like that and having to run to the bathroom to vomit. We expect instead that as you get adjusted and as you learn, you're going to say, gee, I enjoy a quarter, a fifth, a sixth of what I used to eat, but everything tastes wonderful, it's an enjoyable experience, and I'll take that to go. Okay? And even desserts are fine. In other words, we don't want you to make a foundation of cheesecake and blueberry pie and Snickers bars. That's not the foundation of your diet, but we can enjoy those as treats. They're wonderful, tasty desserts and things like that, and so that's fine. That's no problem. Smaller stomach, and then we're going to do something else. We're going to bypass some of the intestine. Remember that the intestine is somewhere between 20 and 30 feet long, and it's that long so it gives it an opportunity for food as it's digested to be absorbed. Okay, we want that absorption to happen. Now again, with our patients, that absorption is too effective. In other words, we're getting more digestion and absorption than we want. So we're going to bypass some of the gut. And as we bypass the gut, we get a peripheral benefit that's very important, and that is we deliver the food to the lower small intestine more quickly, and so that elevates peptide YY approximately tenfold. And we remind you that peptide YY is that satisfaction hormone. It makes you feel full and satisfied. Okay. Now, by having interfered with digestion like that, you can think about different kinds of foods, and that sometimes if you don't digest the food, if your body doesn't digest the food and you leave it in the gut, the bacteria that lives inside you will digest it. In other words, you don't want it, I'll take it. And when that happens, the bacteria in your gut, which is called anaerobic because it lives without oxygen, the anaerobic bacteria eats the food, is very happy with the food, but creates methane and hydrogen sulfide smelly gas. Okay, so certain kinds of foods can potentially generate a lot of gas. When we bypass the upper gut, we really interfere with the very specialized area of digestion, the liver, the gallbladder, the pancreas, right after the stomach, the upper gut, the duodenum, the upper small bowel, where fat digestion is especially good. And to talk about fat digestion, I'll digress for a minute and tell you the story a little bit about the Dawn dishwashing liquid commercial and oil and fat and how oil and water don't mix. Okay? The idea there is when we eat food, we're going to digest it and we want to absorb it. Well, salt and water, for example, and small sugars are very easy to absorb. But fat, because you and I are water, is very hard to absorb. Oil and water don't mix. Okay, so since oil and water don't mix, you and I have been created with a terrific capability to digest fat. How do we do it? Well, I don't know if they ran this commercial in Canada, but there's something called Dawn dishwashing liquid commercial. And you see this sink, and a greasy spaghetti plate comes into the sink, and bubbles of oil appear on top. That's all this kind of oil from the dinner. As those bubbles of oil appear, then from the right-hand side of the TV screen comes a aqua blue bottle of Dawn dishwashing liquid. And there's a squirt of the detergent. It hits the water, and the fat dissolves. Okay? You and I are fitted in our right upper quadrant with exactly the same thing. We have our detergent is green, and it's called bile. So when we digest a pizza or fried chicken or ice cream with lots of fat in it, the food goes into the stomach and we put acid in the stomach, and then little bits of that squirt out in a very measured way into the intestine, and we squirt in bile and pancreatic enzymes which help us digest that fat. It's a terrific system, and in my patients it's working extremely well. So we want to interfere with that.